Hello, my name is Dr. Mohammed Maki. I am a neurosurgeon here at the Cleveland Clinic, and I specialize in spine surgery. What is transforaminal lumbar interbody fusion? The transforaminal lumbar interbody fusion, or TLIF, is a common operation used to treat back pain and/or lower extremity symptoms. The operation entails fusion of one vertebral body to the lower vertebral body to ensure that the two vertebral bodies no longer move relative to one another. What conditions does a TLIF treat? The TLIF is commonly employed to treat spinal degeneration or arthritis, which includes conditions such as spondylolisthesis, spinal stenosis, facet arthropathy, disc degeneration, recurrent disc herniations, and/or scoliosis. We always try to ensure that patients are maximizing on their conservative management prior to undergoing a fusion operation. Conservative management can include physical therapy, over-the-counter medications, or even interventional pain procedures like injections or rhizotomies. What happens during TLIF surgery? During the TLIF procedure, the patient goes to sleep with anesthesia, then is positioned onto the operating room table with the belly down and the back up. An incision is created on the back, and the exposure is taken down to the bone. Next, the joint of the bone is removed. The joint is called the facet. The facet on one side is removed to decompress the nerve. Sometimes surgeons will opt to remove the facets on both sides, depending on the patient's symptoms. Next, the center of the bone, known as the lamina or spinous process, may also be removed to ensure complete decompression of the nerves. Attention is then directed towards the disc space. The disc material is then removed, again from either one side or both sides. The disc removal, also known as discectomy, will ensure that there is ample corridor for the cage to be placed. The cage is made of titanium and is often filled with some graft material, either the patient's own bone and/or artificial bone. This will ensure that one vertebral body will fuse to the other vertebral body. Pedicle screws are then placed, 2 pedicle screws in the top vertebral body and then 2 pedicle screws in the bottom vertebral body. The screws are then connected via rods on each side, so one rod on the left and one rod on the right. The entire construct will ensure maximal fusion of the upper and the lower vertebral bodies. What is the recovery process like after a TLIF? After a hospitalization, regardless if you go home or to a rehab facility, you will need to take it easy for the next 6 weeks. No heavy lifting, no aggressive twisting and bending. You need to allow the surgery to heal, if you will. You'll be evaluated by a healthcare provider approximately 6 weeks after your operation to determine how you're recovering from the operation and to see if some of your restrictions can be liberalized after the operation. It's important to also understand the concepts of fusion. Fusion entails bony overgrowth in and around the hardware. Maximal healing can take 1 to 2 years to occur. What potential risks or complications are associated with a TLIF? The most critical risk during the operation includes injury to the nerve roots, which can cause neurological deficits of the legs. Other potential complications include malpositioning of the instrumentation, the pedicle screws, and/or the cage. During the surgery, the dura may be violated. That's called the cerebrospinal fluid leak, which most surgeons will patch during the operation. In very rare circumstances, a persistent leak may require a reoperation to repair. You should have a thorough discussion with your surgeon before the operation so that he or she understands all of the risk factors present in your case. What are the possible benefits of a TLIF? Benefits of the operation include relief of the back pain and/or lower extremity symptoms. While a spinal fusion may sound daunting, symptom relief with the operation will certainly provide the relief needed to proceed with a better quality of life.